Let's now discuss the societal effect of COVID-19 as it bites hard on all aspects of human life. And we've said before, here in Nigeria, there are measures being taken to stop the spread of the virus. It's a continuous process involving everybody.
Yeah, it involves everybody, and that's why we have joining us to talk about the effect of coronavirus on Nigerian society, Dr. Ngozi Onyia, a consultant pediatrician with experience and training as primary health care and travel health, and occupational and HIV physician. It's a pleasure having you, Dr. Onyia. I want you to talk us through societal impact of what is currently going on.
Our way of living has changed suddenly in 3 months. Let's remember that the first case of COVID was reported on the 31st of December 2019. Today is the 24th or 25th of March. And in 3 months, our whole way of living all over the world has been totally disrupted. It has had impact on various dimensions, the mental health. There's so much fear. And because of fear, reason seems to have flown out of the window. Things that should be done are being left undone. Things that ought not to be done are being done. Of course, there's the issue of the public health. There's the issue of personal lives. There's the issue of businesses and the impact of businesses. Of course, the very important issues of the healthcare workers who are in the front line. While everyone else is running away from COVID, we have no choice but to run towards COVID. So there are many issues to be discussed.
As if for a lot of people, it is still business as usual. What is the worst case scenario we're likely to see from such behaviors in society?
I doubt if it is still business as usual for many people. So let me say the first thing anybody can do, because like Boris Johnson, the Prime Minister of the UK, said this yesterday evening at his briefing. He said, this is a fight that everybody must get enlisted in. It's a global fight. It affects every single individual on this planet, and everyone must be enlisted. And each person has a part to play. The major thing most people can do is to break the transmission, flatten the curve, by staying at home. That's the most important thing anybody can do. Except for those who are essential workers who have to be at work. Everybody else should just do themselves and the whole world a favor by staying at home. I hear a lot of people talking about what the government can do and what the government should do and what the government hasn't done. But these same people are not doing what they should do. So this is a good time for us to look inwards and play our own part, which is to stay at home and break the transmission to slow down the spread of the virus. We cannot eliminate the spread of the virus. Nobody is trying to eliminate the spread of the virus. What we are trying to do is to slow down the spread of the virus so that our very fragile healthcare systems will not be overwhelmed. We are all aware of the state of our healthcare system in Nigeria. It is no secret. So we don't need to try and overwhelm it. And what we can do to make sure that the epidemic passes through Nigeria in a controlled manner is to stay at home and social distancing when you have to be at work. All the things we hear about hand hygiene, washing your hands at every turn, sanitizing your hands. Avoid touching your face. You'll be amazed at how difficult that is until you consciously start trying to do that. Maintain a social distance between people that you have to interact with. And stay at home. Keep yourself mentally fit. That's very important. Don't listen to... There are very, very, very credible websites. WHO has a WhatsApp number anybody can register with and get up-to-date, reliable information. So don't listen to all the fake news and all the negative things going on the social media that will just affect people's mental health without adding any value. And if you feel you are ill, the thing to do is not to go to the hospital, but to self-isolate. If you have been exposed in any way, for example, I think it's interesting to see how transparently the government is acting now, and I must commend the government, talking about the president being exposed to the virus, talking about Abba Kyari testing positive for the virus. This shows that this virus is not a respecter of anybody. It can affect anybody. And the only thing we can do is do our own part. If you think you have been exposed, please self-isolate. It's for more than 80% of the people who will be affected by this virus, it is a mild illness, a mild limiting illness that will go on its own without you doing anything except staying at home, resting and rehydrating yourself adequately. For about 10 to 15% of people, it will be a serious illness. And those are the people who need to be hospitalized. But if all those who are well, but because they have access to hospitals, flood the hospitals, then we will not be able to attend to those who need the care. And then, of course, in flooding the hospital, the infection will keep spreading even within the hospital. Very few people will be critically ill. Between 1% to 7% of people will become critically ill and will require critical care. These people will be mostly the elderly, whose immunity are already weakened by age, or those who are immunocompromised by disease, so people who have uncontrolled diabetes, people who are on treatment for cancer, and those kind of people. They are the ones who are most at risk. Of course, we must remember things like sickle cell disease, which is prevalent in Nigeria and which tends to compromise the immunity as well. A good time to mention smoking. Smoking as a habit can also affect the lungs and make people who smoke, put people who smoke more at risk. But other than that, most of us will have a mild illness and recover. So we don't need to panic because we think we have the COVID virus. The thing to do is stay at home and monitor yourself. Monitor your temperature. The symptoms out there for everyone to know. A fever, most people will have a fever. A dry cough, sometimes sore throat, malaise, feeling weak, and then breathlessness. Breathlessness becomes quite a serious symptom. So if people start with a fever, just monitor yourself. If the fever gets worse, and then coughing starts, and then breathlessness, then that's a good time to call the coronavirus number. We do have one, and I think it's in the public domain. And then the NCDC and Lagos State Ministry of Health, who, by the way, are acting absolutely brilliantly, I'm very proud of them, will now reach out for those who require help and take them to the designated center for treatment, which is the infectious disease hospital in Yaba. A ventilation unit has been created in that hospital. They have bought ventilators and they're in the process of buying more ventilators so that people who require critical care will receive critical care at that hospital. That's the only designated center in Lagos now for treatment. Private hospitals and other government hospitals are not designated for treating the virus yet. They probably will be soon.
Dr. Onyia, just stay with us for our viewers who are just joining us from Nigeria and all over the world. Breaking news we are following at this time on Arise News. Nigeria's President Muhammadu Buhari has tested negative for the COVID-19 virus following a test for the disease that was carried out yesterday on the president by the Nigeria Center for Disease Control, the NCDC. Well, Arise News can report that the NCDC has informed the president on the outcome of his negative status this morning in the nation's capital, Abuja, bringing relief and as well as excitement to the presidential villa. And according to presidential sources, the test for the president became necessary after his chief of staff, Abba Kyari, tested positive for COVID-19 on Monday. Mr. Kyari had traveled to Germany on Saturday, March the 7th, to meet with officials of Siemens in Munich on the Nigerian electricity expansion program. Mr. Kyari then returned exactly 1 week later on Saturday, March the 14th, but did not show any symptoms. He was said to have even been at a meeting on containing the COVID-19 pandemic in Nigeria all through Sunday, where he reportedly started to cough. Subsequently, he voluntarily submitted himself for testing and has gone into isolation and treatment. We'll bring you details of this breaking story subsequently on Arise News. Breaking news we're following at this time. Just to remind you again of the breaking news we're following on the Rise News at this time, Nigeria's President Muhammadu Buhari has tested negative for COVID-19 virus following a test for the disease carried out by the NCDC yesterday on the president by the NCDC. Well, Rise News can report that the NCDC has informed the president on the outcome of his negative status on the disease, and this morning in Abuja, bringing relief and excitement to the presidential villa. According to the sources at the presidential villa, the test for the president was necessitated after his chief of staff, Abba Kyari, tested positive for COVID-19 on Monday. Well, Mr. Kyari had traveled to Germany on Saturday, March 7th, to meet with officials of Siemens in Munich on the Nigerian electricity expansion program. He was said to have returned exactly 1 week later, on Saturday, March the 14th, but he did not show any symptoms of COVID-19. He was then said to have been at a meeting on containing COVID-19 pandemic in Nigeria all through Sunday, where he reportedly started to cough. Subsequently, he voluntarily submitted himself for testing and was informed of his positive status yesterday. He has, as of last night, gone into isolation and treatment has begun. We'll be staying with this story, like I said. I will bring you more details as they unfold. We still have Dr. Onyia with us, a specialist, a medical professional, talking about the societal effect of COVID-19 here on Nigerians. Sheita, you have a question?
Yes, I would like to come in here and talk about the phenomena of panic buying. We did see as COVID-19, the reality of COVID-19 began to settle in Nigeria last week. We did see a lot of people begin to go into the supermarkets and the markets to panic buy. And reports have actually even indicated that even in that space, we did have people not maintaining social distancing and touching themselves and all of that. Now, how do we address, something like this, where we have a body of people trying to get ready for a pandemic, but also making sure that they don't catch the virus while trying to do so?
I think the most important thing is to get the information out there, the correct information. So there's a lot of misinformation out there. There's no need for panic buying. But I think now the awareness is increasing. Like a doctor who I was listening to a little earlier in your studio said, we have learned, so we are 3 months down the line, we have learned from other countries and what they have done right and what they have done wrong. So we are fortunate that the epidemic is coming a little later to us, and we don't need to reinvent the wheel. There's no need for panic buying. We recognize now that, yes, because the COVID-19 doesn't cause a very severe illness in most people, doesn't mean that we should expose ourselves or think we are invulnerable like a lot of young people think. Everyone is vulnerable. Everyone has a role to play, because even if we don't have serious illnesses and we continue to transmit the virus, what will happen is that we could infect our loved ones, our older loved ones, our loved ones who are immunocompromised. Or even if we don't infect them, we could overwhelm the hospital such that when we require care for other illnesses, there'll be no space because the place will be packed full of COVID-19 patients, and therefore there will be the healthcare system will be unable to cope with other regular illnesses, which of course we recognize will continue. They will not stay on hold until we overcome the COVID-19 epidemic. They will continue as usual. So I think it's getting the right information out and letting people know. Employers should please let employees who are not essential stay at home. For example, my driver no longer comes to work. There's no point exposing him in public transport to drive me, to take me on a 10-minute drive from my house to my office. I can do that myself. So we need to rationalize and think about what is important. Those who absolutely have to be at work, because most of our domestic staff and lower paid staff come by public transport. So we should try and keep our buses empty by asking them to stay at home. And those who absolutely have to be at work have to maintain good hand hygiene, social distancing, and all the safety precautions that have been given for people to stay apart. I think as the awareness increases, particularly now that we're hearing that big shots are being infected by COVID-19, then I think everybody will recognize that they can be affected as well, and people will become a bit more careful. I have a habit of power walking every other day, and I have noticed, even as I walk along the road, along Adetokunbo Ademola, that people tend to maintain a social distance. People don't walk too close to each other anymore. I've observed that.
Okay, so Dr. Onyia, real quickly, I've got two questions for you. Number one, based on your slant as a doctor for children, I'd like to ask the effects of this on children. I mean, are they able to build that immunity enough to be able to fight this? I think that's why I was asking a question from somebody yesterday as regards children catching this, like children of 6 weeks, for instance, catching coronavirus. How will they fight it? Will they be fine? And secondly, you're an entrepreneur. You've got a hospital. Has it affected business for you?
Okay, on the first question, interestingly, children seem to be a little protected from this illness. So they do catch the infection, but most children have very mild infections, very, very mild. The only children who have had severe infections are those who are immunocompromised by other illnesses and other diseases. 2 babies have been born. We're not quite sure of how they were infected, but they were born with the virus. So were they infected in utero? Were they infected soon after birth? We don't know. But they've recovered. So far, I don't think any child has died. In Nigeria, we have reported a 6-week-old child who was positive for the COVID virus and has recovered. So children, we think it's because actually their immunity is not as developed. That's the reason why they're not, it sounds a little bit contradictory, but that's the reason why they tend to have mild infections. So yes, children tend to get away with it quite lightly, luckily. But then the danger, of course, is that children, this last weekend I had my grandchildren spend the weekend with me. So the danger will now be a grandchild who has the COVID-19 virus, spending the weekend with the grandmom and infecting the grandmom who now gets ill. So they still have a role in the transmission, but they tend to have very mild infections, like I said. And talking about the effect on business, that's a real challenge. First of all, we all know that China is the main supplier to the whole world. Our supply chains are breaking down, the systems are breaking down. There's not just panic buying in the supermarket, there's also panic buying in businesses. And therefore, things are becoming scarcer. The market forces are coming to play, supply and demand. And then what's happening? Prices are skyrocketing out of control. People are stocking out. The challenges of balancing overstocking with stocking out, cash flow issues. Yesterday, usually we saw less than half the number of patients we will usually see in the hospital. The month will come to an end, next month will come to an end, and I wonder where the salaries will come from. We are having to buy protective gear, very expensive protective gear to protect our frontline employees at high cost to the hospital. We have to protect their lives, but then also it's going to impact very negatively on our cash flows. These are some of the challenges, the things that have concerned me over the last few days and weeks. We are putting all, yesterday we completed the building of a tent as an isolation unit outside the hospital, so that if patients come, suspect cases, we can keep them there in a holding bay whilst we try to reach the NCDC and Lagos states to come and move them away. These things are additional costs. Who will underwrite these costs for us? These are some of the things that have concerned us. But will there be any relief from anywhere for the very obvious financial hardship we face? Then talking about ventilation, when people become critically ill, will the systems not be overwhelmed? Do we have enough ventilators? I think the answer is no. The other day I was listening to a doctor speaking from Italy, the epicenter of the epidemic.
Dr. Onyia, I hate to interrupt you again, but do stay with us. I have 2 questions for you. But first, breaking news. Nigeria's President Muhammadu Buhari has tested negative for COVID-19 virus following a test for the disease that was carried out yesterday on resident by the Nigeria Center for Disease Control, the NCDC. Arise News can authoritatively report that the NCDC the president on the outcome of his negative status this morning in Nigeria's capital, Abuja, bringing relief and excitement to the presidential villa. According to sources at the presidential villa, the tests for the president became necessary after his chief of staff, Abba Kyari, tested positive for the virus on Monday. Mr. Kyari had traveled to Germany on Saturday, March 7th, to meet with officials of Siemens in Munich on the Nigerian electricity expansion program. He then returned exactly 1 week later on Saturday, March the 14th, but did not show any symptoms. Mr. Kyari was said to have been at a meeting on containing the COVID-19 pandemic in Nigeria all through Sunday, where he reportedly started to cough. Subsequently, we are told that Mr. Kyari voluntarily submitted himself for testing and was informed of his status yesterday. He has, as of last night, gone into isolation and treatment has begun. We'll be staying with this story all through the bulletin here on the Rise News. Dr. Ngozi Onyia, a medical professional, thank you so much for staying with us. We just had to take that breaking news again. You wanted to land on that point you're making about the doctors in Italy, but I do have two questions for you. First, there are those who say COVID-19 is here to change our way of life. But what are the likely impacts of this, even when all of this is over? Do you think that COVID-19 really will change our way of life as humans? Because we have seen other pandemics and outbreaks. Secondly, WHO has advised that in a containment level like this, you should test, contact trace, and treat. But when it comes to contact tracing, Nigeria seems to be having a challenge. The minister said yesterday we are still yet to reach about 1,300 people. In Russia, the authority is threatening 5 years imprisonment for anybody who refuses to self-quarantine. Do you think that we should take drastic measures for that level of containment, contact tracing?
Well, the first question, changing our way of life, I think it will do so for a bit. I don't know what a bit will be. Could be quite a couple of months, could be years. One of the attributes of the human brain, or one of the functions actually of the human brain, is to forget. Imagine if we didn't forget anything. So with time, this will become a memory, hopefully. But for now, it will definitely change the way we live. I think one thing I hope that will come out from this is the fact that, I was looking this morning at John Donne's No Man is an Island to Himself. He wrote that poem when he was suffering from an illness in the 17th century. I think this is a good reminder that no man is an island unto himself. We are all a part of each other. And what I do impacts what I do impacts you, and what you do impacts me. And I think that's a good reminder. Clearly, we will go into a recession. That is inevitable. So we will go into a recession. I don't know how long and how deep it will be, but that is one factor we have to face that will affect the way we live for a while. I hope the idea of the hand washing and the personal hygiene will continue and will become a part of us. Then talking about containment, first and foremost, we are not doing enough testing in Nigeria. If we look at the story of South Korea sort of stayed ahead of the pack by developing rapid tests, biotechnology to stay ahead of the pack. They very rapidly developed rapid tests, and I think they have the capability of doing 20,000 tests per day. No other country does. So one of the things I will appeal with the WHO to do is to quickly accredit and some rapid tests so that rapid testing can become widely available, because we can only do contact tracing when we have tested.
Welcome back to the morning show. We're still joined in our Lagos studios by Dr. Ngozi Onyia, a consultant pediatrician with experience and training as a primary care, travel health, occupational and HIV physician. Now, we are talking about the societal effects that COVID-19 has had on our nation. And I want to quickly talk to you about the stigmatization that comes with having COVID-19. A very popular individual refused to go in for checking because, you know, he was afraid of how Nigerians were going to react. And eventually, when his identity was released, we did have a bunch of people go on his social media to attack him for not going in. Now, as it stands, there are a lot of people who might be feeling the symptoms but are afraid to go in because of the stigma that is attached to having COVID-19. How would you react to that? And how would you tell people to treat certain individuals that may have this disease?
Well, I'm not sure I know which individual you're talking about, but I hope it's not who I think you're talking about. But I think the fact that high-profile Nigerians like Vice President Atiku Abubakar has come out to say his son has been affected, has tested positive, and now we have been informed that Abba Kyari has tested positive. I think that will help to reduce stigma. That will help to reduce stigma. President actually got tested, and if he had tested positive, I think we will have been told as well. So I think that will help reduce stigma. So I think the issue of stigma has been taken care of by these high-profile infections.
All right, real quickly, I want us to start even looking at recovering from all of this when all of this is done. Because like they say, we need to look at the positive side. This too shall pass. What will be that mechanism when this finally passes? Because a lot of lives will be changed forever. Economies will never remain the same. What should be the watchword as we start to move and as we start to recover when all of this is over?
Our government has to behave responsibly. Already there have been a few measures put in place, like the central bank has announced some relief package for business owners. They have reduced interest rates. They have also increased the moratorium for repayment of loans and things. We will need more of such. And then, of course, they need to be more accessible, because it's one thing to hear that the central bank has reduced interest rates. Are those loans really accessible? I've tried to take quite a few loans, and I know how difficult it can be to access loans. The government has to become a lot more responsible in that regard, bring in relief measures to help lift us out of recession, as other countries are doing or will do when the time comes. So the government, we're looking up to them to see how they can bail us out of the inevitable recession that will come and the economic hardship. Give us some kind of financial relief. Governments all over the world are doing so much, giving money, paying workers to stay home in the UK. There are so many examples that our government can learn from, and I hope they will learn from.
Nigeria is nearing almost a lockdown state. I mean, the judiciary, the National Assembly, the international airspace, the land borders, schools, religious gatherings, social gatherings, all have limitations now. But what's your take on those calling for total lockdown at this point, where we have 40 cases, 37 active, 2 discharged, and unfortunately 1 death recorded yesterday? That's one. And then earlier I asked you, making comparison with Russia, that has threatened 5 years imprisonment for those who refuse to self-quarantine. We had to go on a break, so I really didn't get your response. Nigeria is struggling to contact trace about 1,300 people at the moment. Do you think that we need to take those drastic measures?
No, I will never recommend drastic measures. Don't forget that for too long we have had military governments in place, and already we have a military mindset in Nigeria. So I will be very reluctant to encourage what is considered a democratic government to take such draconian measures. I think giving information, of all countries, I admire the UK and the way they have handled the epidemic better than any other country, I think we need to follow the science. I think we need to know, we need to be able to, there's something called a base reproduction rate, which is the rate at which one person can infect more people, and it's about 2.2, between 2 and 3. In other words, the epidemic increases in an exponential fashion. So today there are 2 people infected, and 2 people will infect 2 to 3 people. So tomorrow it will be 6 people, and then the next day 6 times 3, 18, and so on and so forth. So a critical point will come when the government will need to lock down the country. If it is done too early, the economic impact will be terrible. If it is done too late, the impact of the epidemic or the fear of overwhelming our healthcare systems will occur. So what we need to do is get that right balance between the right time in terms of protecting our economy and protecting the healthcare systems. And then a time will come when there might have to be, not those or imprisonment, jail terms or anything like that, but when people will be asked to stay home the way it's been done in Italy, for example. That time may come, but I think we just need to see how it evolves. Let's remember that this is a brand new virus, only 3 months old. We don't know a lot. We don't know everything that should be known. We are learning as we do. That's the honest truth. So I think the government should just stay responsive, not react, but stay responsive, listen to the scientists and the healthcare workers, people, the experts, and review on a daily basis. On a daily basis, review and take proactive steps as the case will be.
That's a good place to leave it. Thank you so much, Dr. Onyia, for coming on the morning show here on Arise News today. Much appreciated. Well, before we go, let's bring you up to speed with that breaking news we have been following this morning here on Arise News. President Muhammadu Buhari of Nigeria has tested negative for the COVID-19 virus, and that's following a test for the disease that was carried out yesterday on him by the Nigeria Center for Disease Control, the NCDC. And the Rise News can report to you that the NCDC has informed the president on the outcome of his negative status this morning in Nigeria's capital, Abuja. And that brought a lot of relief and excitement to the presidential villa, as well as many Nigerians. According to presidential sources, the test for the president became necessary after his chief of staff, Abba Kyari, tested positive for COVID-19 on Monday. Mr. Kyari had traveled to Germany on Saturday, March the 7th, to meet with officials of Siemens in Munich on the Nigerian electricity expansion program. He then exactly 1 week later, on Saturday, March the 14th, but Mr. Kyari did not show any symptoms. He was said to have been at a meeting on containing the COVID-19 pandemic in Nigeria all through Sunday, where he reportedly started to cough. And subsequently, Mr. Kyari voluntarily submitted himself for testing and was informed of his positive status of the COVID-19 yesterday. He has, as of last night, gone into isolation, and we do hear that treatment has started. We'll be bringing you details of this breaking news in our subsequent bulletins.